So this is part 5, and this is what we call older adulthood. I know we don't like to reference that, but anywhere from 60 years of age and greater. So some of the tips and risks that we have for this age period, older adulthood, 60 plus, for any of you that are in that or have a family member that are in that category, is we want to look for remedies for dry mouth or xerostomia. There's saliva substitutes. There's toothpaste called biotin, which help a little bit. Some people say they do, some people say they don't. Chewing gum that is sugar-free with xylitol that helps to produce saliva. At its worst state, there is medications that can help you produce saliva, but we want to try to avoid medications because there's always a side effect that comes with the medication. But also some of the things that will help you if you're in this category of xerostomia or dry mouth is try to avoid caffeine and alcohol, because those things are going to also dry your mouth out. Denture care, or here at Dental Masters we like to say no more dentures, but if you have a denture, you need to make sure that it's being cleaned properly. So when you come in for your regular checkup, and by the way, if you do wear dentures, you still should come in for a checkup, because you want to see if the denture still fits. You want to check for any of those spots that could appear on the gum tissue. And also, let's talk about getting rid of your denture and giving you some teeth that stay in place if you're somebody that wants to move in that direction. But it's important that you come in for your checks, bring your partials or your dentures so we can look at it, make sure they still fit, and again, maybe discuss. Some of you may think that you don't have enough bone for teeth that stay in, supported by implants. But I can tell you from my almost 20 years of experience that there's almost always a solution, whether it's a special type of implant. Again, that's a whole other topic, but that's one of the things that we want to talk about, is cleaning your dentures, bringing them into your appointment, and maybe talking about getting out of dentures. And then again, the regular oral exams are important. You may have noticed that that's been on every single segment of this series, but coming in for your recommended and regular oral exams are important for all the things that we talked about: cavities, dry mouth, tooth loss, checking your dentures, checking to get out of dentures, oral cancer. So keep coming in for those regular checkups, take them seriously, and the advice that you're given, make sure you take that seriously as well. So the risks of this time period of 60 plus years is, we talked about a little bit a second ago, tooth loss. So it's important that we look at which teeth maybe are at higher risk for being lost. Maybe a tooth that's had a root canal, maybe a tooth that has a cavity with a large filling, and do what we can to prevent that. But if indeed you get to a spot where you need to have a tooth removed, maybe a failed root canal, then it's time to discuss if you're a candidate for an implant to replace it, because it is the best way to replace a tooth and actually the most conservative way. Systemic health issues. So certain conditions we want to make sure that we are aware of. So make sure that you are very thorough when reviewing your medical history with your dentist, so that we can fight whatever things that come along with your medical conditions, whether it's dry mouth and other things that affect the entire body that start with the mouth. Oral cancer, again, we spoke about that before. It's a risk as you age, so it's something that we're going to be looking for every time that you come in. We do it for everybody, but we are going to be more alert at this age group. This was part 5 of our 5-part series, the older adulthood or 60 plus age group. Just gave some general tips. And again, I want to thank everybody for watching this journey. That's really important that you know what happens from when you're a baby to when you're older with your teeth and your oral health. And if you're picking it up later on episode 4 or 5, please go back and watch the earlier ones. And this way you can share this information with other people. I think it's really, really important so that people can understand what's important for you as you go through this whole cycle with your oral health and your teeth. So again, thanks for watching. Please share, and everybody have a phenomenal day.